Russell, drug testing at festivals.
Thank you. London is known for its thriving festival scene, which attracts people from all over the world and offers Londoners access to global culture. It's important that festival goers can enjoy these events safely. The use of illegal drugs harms individuals, families and communities across our city, and recreational drugs are a part of this. However, all Londoners deserve to be kept safe. I'm committed to working with partners to reduce the harms that drugs cause, including drug-related deaths. I've set up the London Drugs Forum, chaired by Dr. Tom Coffey and Sophie Linden, to develop an effective pan-London whole systems response to drug-related harms and crimes. And I've established the London Drugs Commission to consider evidence regarding the impacts of cannabis on people's lives and communities. The work being done to test for drugs at events is important both in terms of public health and the opportunities it provides for community engagement and public education. There are many ways to reduce drug-related health harms at festivals. These include encouraging people to seek medical help without the fear of criminal repercussions for doing so, the availability of medical assistance, and staff training for individuals working at festivals. I'm aware that the government recently told The Loop, a charity that has been providing drug testing at festivals since 2014, that it must now apply for a controlled drugs licence to continue its work. This new requirement, introduced in the middle of the summer festival season, not only adds costs the charity like this may not be able to afford, but effectively means they cannot operate this year owing to the process for applying for a licence. I've discussed this with my health advisor and at London Health Board last week. We had a wider discussion about the use of drugs and harms reduction. The topic will be discussed at the next London Drugs Forum meeting. The Met already works with organisations who test drugs at festivals and those surrendered in the nighttime economy, and are committed to working with festival organisers to reduce the potential harm caused by drug misuse at festivals and events. It's clear that the government needs to provide clarity on the legal and policy position at drugs testing at festivals, so festival organisers can ensure they have robust strategies in place to keep festival goers safe.
Thank you very much, Mr. Mayor, and it is very reassuring to hear that you have been in dialogue with The Loop. I've also met them, and they've told me that it's this back-of-house testing where the police maintain oversight of the drugs at all times, which helps with that multi-agency response, which where they gather intelligence and then they can support the health and emergency services to keep people safe. So I was actually wondering if you would consider helping to reduce this drug harm at festivals and other events by asking the Home Office to further re-clarify the shift in the licensing arrangements so that that kind of back-of-house drug testing at festivals can continue.
Thank you for your question. Thanks for raising this really important issue. I'm not sure if the government realises the consequences of what they've done. So you'll know this, but so these are potentially dangerous drugs that one dealer supplied.
Yeah.
That this testing means that they can let everyone know there's a dangerous drug in circulation, and that could save lives. In the middle of festival season, and so the Drugs Forum is looking into this. I'm more than happy to raise this once the Drugs Forums have looked into this, but I'm worried about what happens this summer.
I think there is an issue this summer. I'm going to write to you afterwards with more information because I think your voice could help to keep people safe this summer. Now, some of the most vulnerable Londoners who experience the worst health inequalities don't just use drugs during the summer or at festivals. Now, this cohort of people tend to use opiates, and they are most at risk of overdose. Now, the Assembly Health Committee recommended drug checking services in our report on drug harm reduction. And in your response over a year ago, you said that interventions like these would be considered as part of the multi-agency partnership work of the London Drugs Forum. Now, I've not seen any update in the minutes of the London Drugs Forum about this, and I just wondered if if you're aware that whether they've made any progress on this.
Well, Chair, you'll be happy to know that I'm about to give an example of instant response from the GLA to a point raised by the Assembly. And as a consequence of you raising that point, I'll make sure at the next Drugs Forum meeting they take that point forward, Caroline, because we've got to recognise that even in between festival seasons, there are people who may be taking stuff that's, whether we're not condoning drug taking, right? But it's dangerous in the sense of, everyone's life. We should be trying to support them and stuff. So, can I make sure I'll make sure that's raised at the next meeting?
Thank you. Now, there is a need to get this information about what drugs are circulating and also to link up people who do use drugs to addiction, health and other support services. Now, there's a difference between festival testing and what's known as front of house testing, which happens in premises that are actually licensed for this work, and that can really help Londoners, save Londoners' lives. They provide face-to-face, non-judgmental interventions, which are actually just as important as the drug checking, because 95% of the people who use these kind of drug checking services have never spoken to a health professional about their drug use before. So would you also explore with the Home Office and also with your Drugs Forum how you could support provision of these kind of licensed premises type drug testing facilities in London?
It's my fault and nobody else's. I'm not aware of what the members refer to and stuff. I'm happy to take this away and look into it, but I mean, it's my fault, nobody else's. I'm just not aware of what the members are referring to.
Thank you very much.
I wouldn't mind if, I'm sure she will do this anyway, if Assembly Member Russell could share that response with at least myself, and the rest of the Assembly. Thank you. The next question is on low traffic neighbourhood support, and it comes from Assembly Member Berry.
Thanks for your question. Low traffic neighbourhoods are a